Welcome back. On behalf of the Culpeper Police Department, good evening to everyone, and welcome to the first combined Neighborhood Watch Meeting and Amazing Citizen Award of 2021. For those that do not know me, my name is Lieutenant Ashley Banks with the Culpeper Police Department. I am in charge of the Community Policing Division at the PD. It has been over 18 months since the Police Department has held this event, and we are so excited to have you here in person and watching live on the Culpeper Police Department Facebook page. About 2 months ago, Chief Chris Jenkins called a meeting with some members of the police department and said it is time to get the combined Neighborhood Watch Meeting and Amazing Citizen program back up and running. Everyone was in agreement with him, and the chief's famous words are, "Let's make it happen." So here we are tonight for the first meeting. Thank you. We would like to recognize a few special guests in attendance. We have Town Manager Chris Hively. We have Town Council members William Billy Allen in attendance. Thank you. Frank Reeves. Keith Price. John Russell. And former Mayor Chip Coleman is with us tonight. I would also like to recognize Donna Staten, the president of Culpeper Medical at UVA Health Systems, for being here tonight. The executive director of SAFE, Cindy Hedges, is here. And I would also be remiss if I did not thank Pastor Dan Carlton and the Culpeper Baptist Church for letting us host this event here tonight. In addition, the Culpeper Media for filming, Culpeper Times, Culpeper Star Exponent, and WJMA 103.1. So we have a quick video, and then we will go into the Amazing Citizen.
Welcome to Culpeper, a town and county unlike any other. Pastoral views, a vibrant downtown, where destinations and activities abound. There is one aspect in particular that helps Culpeper rise above the rest: the people. Every day, all over the community, people are working to make a difference.
Amazing citizen is someone who represents their community well.
To me, an amazing citizen is one who goes above and beyond.
Someone who has the ability to give resources to people and provide them information that they may not have.
Willing to go above and beyond in any circumstances, willing to always put others before themselves.
It's someone who lives and works and embodies all the things that we want in a good citizen, which is helping others, right? Helping all of us be the best people that we can be.
We need leaders, and Ashley is a leader.
Ashley is a director of special projects, and what that means is she is a jack of all trades. She does any and everything, and she really has demonstrated her ability to do just that.
It's always above and beyond with Ashley. She is a ball of energy, very organized. If it can be done, she'll do it.
Ashley has an amazing sense of empathy and servant heart for others. She, in the midst of COVID, came to me and said, I want to make a difference. I am not in a role in the hospital right now that I can be on the front line, that I can provide patient care. Use me and put me wherever I can help, be a resource to make a difference.
She went from individual hospital care and really took on the role of public health.
and Ashley organized all of the hospital's vaccination clinics and actually helped run most all of them.
She handled a lot of the logistics and the scheduling and herding all the cats and all the pieces and moving parts that had to be put together to get this job done.
Originally, when the hospital approached Superintendent Dr. Brads about getting vaccinations and having a site where people could be vaccinated, Donna Staten, president of the hospital, got me in touch with Ashley. So Ashley and I started working back and forth, trying to get logistics set up with Kathy Walsh, our nurse coordinator, and we started working immediately. She called and said, when can we be ready? We said, teacher work day is next week. There are 2 days with no students. We said, let's get to work. So Ashley, she was excellent. She was so organized, and we've had thousands of people vaccinated, actually. So Ashley is the one that got all of that started.
When vaccines became available, along with state guidelines on who should be given priority, Ashley realized that many critical town employees were not on the priority list. Instead of sticking to the state guidelines, she used common sense and made sure these critical employees had an opportunity to receive the vaccine, ensuring our critical public services were protected. When the town needs to engage with the hospital on community projects, it always relies on Ashley to get it done.
Every vaccine was used every day. She and Kathy Walsh would stay until 6, 7 o'clock at night calling people on the phone and saying, come in and get a vaccine. They did not want to waste one dose.
And every time that I worked with Ashley, it didn't matter the news or the number. It was always met with a cheerful, we got this, we'll figure it out, we'll make it work, we'll get the shots in arms.
I know she personally would call people at night and on weekends, and she would take all of their information and she'd put them into the computer system.
The numerous conversations I overheard her on the phone with patients working to get them scheduled for their COVID vaccine. Even to the point that she would come to my office many times and say, I just need to tell you about this conversation. I don't think I can make this up. I had one little lady who said, Ashley, I'm in the bathroom. Can you hold on just a minute, because I want to make sure that I get your call, because that's how important getting my vaccine is to me. The level of patience, the level of engagement, the level of just way above and beyond the normal call of duty that I heard Ashley reach out to these patients. Every patient was special and unique to her.
She was making those personal phone calls, and people were so appreciative of her efforts, and when they came in, just thankful for everything.
There are lots of stories throughout this pandemic response, and there are so many times when all of us were ready to just pull our hair out and say, Uncle, we cannot do this. And so, I could text Ashley, send chocolate. And she was there for me. She was there for all of us. And I think, we have 5 counties at the health district, and we worked with all of our partners to do this. And Ashley and the whole team at Culpeper Medical Center were phenomenal.
But it was her really that was the key to all of it.
To be that involved and organized and dedicated and still manage a home with 2 children. It's admirable.
For Ashley as a woman and as a working mom of 2 small children, I think she sets an example of for others to aspire to, that it is possible, and she can do it. And if she can do it, then we can do it too.
Welcome, everybody. It's great to be back. And coming back out of this break that we've had, isn't it ironic, even though we're not out of the woods completely yet, but one of the key folks in our community, Ashley, has worked so hard behind the scenes and really contributed to making this very possible to get back out and start to resume somewhat of a normal life. And I can't tell you, I know Major Settle reached out and called Ashley probably every single day. I know she was probably fed up with him calling. I get fed up with him calling, so I can only imagine. But she never said no. She took care of folks, like April said. I mean, many times we wanted to say uncle as well. I'm not sure. I mean, if people really remembers what that means, but we say it a lot downtown. But this Amazing Citizen Award, as you know, is key specifically for someone who works behind the scenes, that's not gravitating for headlines, and makes a tremendous impact to our community. So how she does it, I'm not sure. I guess she has a great support team here with her that makes it happen. The hospital, Donna has a great support team. I'm a patient recently. They took great good care of me. Emergency room does a great job. But we appreciate our relationship with the hospital and all that the hospital does. But as Donna would say, it's so many moving parts. There's so many great stories that has come out of the COVID era that we will be telling about for years. But tonight, we are able to celebrate one of our local, homegrown, amazing citizen, Miss Ashley Coleman Carter. So again, Ashley, congratulations. So we have some great prizes here that you may want to hold on to and don't share with the table here for you. So it's on this board you will see a number of my favorite personal businesses in our community that contributed to Amazing Citizens Awards. And so Culpeper does appreciate. It's a great community. It's a great community that's defined by its people and its great shops and restaurants. So I'm not sure that Ashley covered it, but Moving Meadows Farms, again, right here on Main Street, one of my favorite, great cheeseburger. Green Roost, we all know that's right across from Knackles, who happens to be underneath there. I'm not sure how Green Roost, do we know how that happened, Green Roost? How that happened? Shenandoah Garden Spot. Boy, everybody knows when you go down Main Street. Isn't it a great downtown Main Street to go by that place every day? So there are some of our sponsors. Did I miss anybody? Don't tell Chip about this one. It's about time. Somebody's going to dinner. And you get to take somebody with you. So, Ashley, we want to ask you to join us here on stage. Very. This is the best Vanna White I could get tonight. I'm sorry. We're really struggling, manager. I like to read this without my glasses, so bear with me here. It is with great honor to present Ashley Carter with our Amazing Citizen Award in recognition of your endless efforts dedicated to community outreach and involvement. The Culpeper Police Department and the community we serve appreciates your dedication and unconditional support. I agree with that. Your commitment to community service truly epitomizes what makes you an amazing citizen. Congratulations on this outstanding accomplishment and presented by a very grateful community and a very grateful police department. Congratulations. Now, all the fun stuff. We go open them up. A gift certificate, Moving Meadows. Great cinnamon buns. Oh, this is the Amazing Citizen Award. It's about time. Or the Copperfish. Lunch for two. Very nice. Now watch a guy in a green shirt. Truly one of my all-time favorites, Knackles. Shenandoah Garden Spot right here on Main Street. Nice gift certificate there. Pick out something, whatever you want. Plant goes with it. Okay, Chip, you can help out now. That requires watering, so. Her favorite retail spot. A nice gift. It seems really heavy. I think she went all out on this one. So the Green Roost. I'm not giving this. Located right across from Kannackles. That's it. So again, Ashley, you represent what an amazing citizen is for an amazing community. We thank you for all you've done and what you're going to do. So thank you very much. The mic is yours if you'd like to say anything.
I certainly am humbled and honored to receive this award today, but truly and honestly, this wouldn't be possible without this amazing community that we live in. I'm proud to call Culpeper home, and my husband and I chose to come back to this community to raise our family, and it didn't make me more proud than working with that team that you saw in the video. And they said I was the yes man. The only reason I was saying yes is because I knew every single one of my team members would say yes when I asked them. And thank you to Donna for the support, for giving me the opportunity to do this, because it truly was a rewarding experience for me to see everyone walk in and thank our team, that they could go hug their grandkids and that they could go travel to see family. And that was rewarding. This is wonderful, but that really warmed my heart. So thank you all so much.
Thank you. That sounded a lot like a politician's speech there, right off the cuff. Yeah. No teleprompter or anything there, you know. But, well, I'm going to let Ashley have it back, but again, it's great seeing everybody. Again, the hospital has an amazing staff of folks. All the folks who endured through this COVID and their families, it's pretty remarkable. I know I have a lot of our folks back here. I can't tell you how proud I am of the staff of the police department. I know everybody thinks that I put this all on by myself. And I tell you the truth, for the most part, I do. That's far from the truth. And if I started calling out names, I'm going to forget somebody, and tomorrow morning, I'm going to get my Dunkin' coffee. So we have amazing staff of folks that comes to work every day to keep our community safe, and to each and every one of you. And I'm going to call out Ashley Banks' name tonight, because half of his staff that helps him put this together is on vacation or in training, and we've gave him a hard time this week. I'll be honest with you. I know he can go home tonight and be relaxed, but again, it's wonderful seeing everyone out here. We have a great. I won't get to talk anymore before Jim LaGraffe, our Executive Director of Rappahanock Community Services, speaks. But he's going to speak tonight on a topic that really kind of ties into all of this. As you know, we had a mental health crisis, a overdose, substance abuse issue in Culpeper way before COVID ever came. And I can tell you, since we've got some relief from COVID, it's back. It's hitting this community very, very hard. And one of the number one questions that I get from parents, from spouses, is how do you access services? And it is a maze. It is a road. You need a GPS system to kind of help you get through that. So we didn't have a GPS, but we got Jim LaGraffe, and we appreciate him coming out this evening. He's doing an amazing job at the Rappahanock Community Services. I think he's right around 3 years, maybe, Jim. And the amazing turnaround that he's brought that agency with probably over 400 some employees that represents 5 counties, and the impacts that they make on the most vulnerable citizens of our community is pretty amazing as well. So I just wanted to throw that out to Jim, because they won't let me talk anymore here. So I thought I'd better get that in. So We appreciate everybody coming back out tonight. Ashley, again, congratulations. Thank you for all you do. Great, amazing family and support team that you have. 2 beautiful kids. How you do it all, I don't know. But very good. Chris?
Again, congratulations, Ashley. Does not let you off the hook for me calling you all the time, by the way. We still have needs, so we'll be calling. Right now, we'd like to take an opportunity. It's been a while since we've all gotten back together, and it's such a great time to see everybody back together in the same room again. And since then, about a year and a half since we've met as a neighborhood watch, we've hired some new officers. And we want our community to know our new officers, and it's very important. And I like to call all of our new officers up here. Before they get a call, or they say they get a call, I want all of them to stand up on the stage under the bright lights. I'm going to introduce them to our community. So come on up. Ashley, come on up. They hate this stuff, by the way, but it's like the Green Mile up here. So this is not, unfortunately, this is not all of them. But I will tell you, we have done a tremendous job. Town Council has given us the tools to go out and find good, qualified law enforcement professionals, and that's exactly what we have found in this group and beyond. And like the chief said, we have an amazing staff, and this group has come in and really taken the bull by the horns and done the job out here on the streets. Most of them work nights. Well, they all do work nights, and they're out here while we're all sleeping, including me, protecting all of us. So real quick, some of our new officers, this is not all of them, but I'll go to my left. Ashley Parker, she is an officer. She comes from King George. She just got married, by the way, and she bought a house here locally, so that's what we like to hear. But this is Officer Ashley Parker, so Ashley, say hi. See, they hate it. This is Madison Healy. She's actually one of our newest employees. She comes by the way of Warrington PD. She came south and joined the winning team here in Culpeper PD. And she is a former Eastern View graduate and athlete, very famous field hockey player. And all state, all regional, she's all decorated. But this is Madison Healy. What's your name again? No, I'm not gonna. I forget sometimes too. This is Nathan Earnshaw behind me. He comes from us from Fauquier, and he's made a tremendous impact. Jumped right into our field training officer program, along with Ashley Parker, and has been really a rock steady out here on nights for us. So Nathan Earnshaw, he just got married as well. Not to Ashley, but to somebody else. But the reason I say that, they're work spouses, so they admit it to you. So Nathan Earnshaw. And we have Van Grimes here, good-looking fellow, the really husky one. Not Campbell, he's a little smaller, but Van Grimes is one of our newest employees. Van's one of our newest employees. He comes via Warrington PD as well. He's a Fauquier native. Just had a child 2 weeks ago. Brighton Max is his son's name. So just had a child, a new dad, first time. A VMI graduate, and he's a decorated wrestler from Fauquier, a big rival of Eastern View. But anyway, Van Grimes. Then we have Master Police Officer Chris Campbell here. Comes via Warrington PD and also Fairfax County PD. Came south where all the good police officers are from Fairfax. Just got Master Police Officer. Great impact into our field training program as well. Came right in, lockstep to what we were doing. Christopher Campbell. So we're going to take about a 10-minute break just for photos with the Coleman family and the Carter family. And we got plenty of food, so go hit seconds, hit thirds. There's a lot of cookies out there. These officers are going to hang around a few minutes, so ask them a lot of hard questions. They're here for you. They're here to serve you, and that goes for any one of us. So we'll take about a 10-minute break, and we'll be back. Thank you.
If everyone would take their seats, we'll go ahead and get started with part 2 of our program. Hope everyone got enough to eat. We'll go get it started with the second portion of the combined Neighborhood Watch and Amazing Citizen. I'd like to thank two people that are here, Allison Brophy with Culpeper Star Exponent and John Bankus. John is our embedded mental health worker that works with us here at the Culpeper Police Department. John was actually out with officers. That's why he was a little late showing up. John, thank you for being here. For our guest speaker tonight is Executive Director Jim LaGraffe with the Rappahanock Rapidan Community Services. He will be speaking on accessing services for mental health and substance within our community. Before I bring Mr. LaGraffe up, I asked him to do a short bio, and it's a couple pages long, so I'll kind of be brief and go through it quickly. Mr. LaGraffe began as the Executive Director for Rappahanock Rapidan Community Services on April 9th, 2018, serving the 5-county area of Culpeper, Fauquier, Rappahannock, Orange, and Madison. Mr. LaGraffe was born and raised in Syracuse, New York, where he earned a bachelor's degree in elementary education from the State University of New York College at Oswego. He completed coursework towards his master's degree in public administration from the Maxwell School of Citizenship at Syracuse University. Mr. LaGraffe has a long professional history in human service organizations supporting individuals with intellectual and behavioral health disabilities. He has served as a state representative for Pennsylvania with the American Network of Community Options and Resources. Since his arrival at RRCS, he has been active with multiple community work groups and has been asked to represent our health planning region on the Virginia Department of Behavioral Health STEP, Virginia Advisory Committee, whose purpose is to reform Virginia's behavioral health system of care based on the national best practice models. Most recently, RRCS was selected as one of 5 CSBs in the Commonwealth to begin the early implementation site for the Marcus Alert legislation. This legislation seeks to establish protocols for the partnership of behavioral health providers and law enforcement to be better able to serve our community members in need. Without further ado, Mr. LaGraffe, will you please come up?
Thank you, Ashley. I appreciate it. So I very much appreciate being given the opportunity to be here this evening. And hopefully, feel free if you have any questions or anything like that. I'm very comfortable. Just interrupt, raise your hand, and I'll be happy to answer any questions as they come along. So now, Dan, it buzzed. Let me try again here. Not clicking for me, Dan. It's flashing battery. Okay. So there you go, Dan. I appreciate it. So I'll do a wave or a pat on the head or something when it's time to advance. So when I was asked to speak this evening, you have to have some sort of little opening. So I have 2 options for openings. I'm going to give them both tonight, and whatever one you like better is the one I want you to take home and remember me by. So the first one is a little quicker. The first one is, from what I understand, this is the first time the Neighborhood Watch Group is met in 18 months, and the best the chief could do was get you me. So I really apologize for that for you. But the second one is I was trying to think about how to talk tonight and relate it to the Neighborhood Watch program. What I thought I would do is share with you, see Dan's missing my pat on the head, is my Neighborhood Watch program. So this is Sophie, this is my Beagle Dotson mix, and she watches everything in my neighborhood, and I live a little bit outside of town in the Boston area. Any leaf, any deer, anything, Sophie alerts me, but more importantly, this is Sophie's partnership with enforcement. This is Alice. And so Alice doesn't say too much, but Alice is really good if Sophie alerts her to stand up. And unfortunately, the reality of my Neighborhood Watch program is this. That's really what I get with my Neighborhood Watch program. And, of course, my favorite part of this is the little dog's in the big dog's bed, and the big dog's laying on the floor, and, of course, the little dog bed is vacant, which is how it usually goes in our household. Luckily for you, you guys have the Culpeper Police Department, who is a great partner with our Neighborhood Watch program, so you're much better off than I am. A little bit of background about us as an organization. Rappahanock Rapidan Community Services serves as the Community Service Board for what we call Planning District 9. Planning District 9 is the 5 counties, Culpeper, Orange, Madison, Fauquier, and Rappahannock counties that make up our region. And additionally, everybody just refers to us as the CSB, which is true. But I also always like to point out to people, in addition to being the Community Service Board, we are also the Area Agency on Aging. And I think that's a real important distinction because we are the only community service board in Virginia that is also an area agency on aging. And there are 40 community service boards. And I think it's a great partnership, and I think we get a lot of benefit from it. Additionally, because community service boards as a model are actually very rare in the United States. I think there are 4 states right now that have the community service board model. And because I have not heard of any other community service board nationally that's also an area agency on aging, I say we are unique nationally. And I'm going to continue this lie until someone corrects me on this. But, you know, I think we are really unique and are very fortunate because of that. Our authority to exist actually exists in the Code of Virginia, as well as the Older Americans Act, and some references up there for you. And our mission of our organization is to improve the quality of life in Culpeper, Fauquier, Madison, Orange, and Rappahannock counties by providing comprehensive behavioral health, developmental disability, substance use disorder, and aging services. And that's kind of what we do. And again, I'm not going to read through all of these, but just an idea of some of the scope, because I don't believe most people in our community have any real concept of the scale and the scope of the services that we are providing. And so as the Community Service Board, our entity is the entry point for behavioral health, publicly funded behavioral health services in our region. And we do that through community-based mental health services, crisis services, which we will talk a little bit more about later, a lot of case management, state hospital diversion, and some of these other types of things. And as the Area Agency on Aging, our focus is actually very similar in what we try to do. We try to prevent institutional care. We try to prevent isolation, and a lot of those types of things, but for individuals who are 60 years of age and older. Okay. Just a little background information for people to understand on how we are funded, because that always comes up. So this year, as an organization, our budget is actually going to be almost $32 million. Actually, I think we just creeped above $32 million since the budget was passed. Our money comes from a variety of sources. We receive state funding. About a third of our funding is state funding. Our local counties contribute about 10% of our budget. And by statute in Virginia, we have to have what's called the local match of about 10%. So we're right at that level as a community. We receive a lot of Medicaid fees. We receive some federal funds, not a lot of federal funds. And there's about, a little less than 20% of the organization is a variety of other funding sources, whether it's fundraising, grants, fees, a lot of those types of things as well. And as an organization, we employ about 415 people. Okay. We are governed by a 15-member board of directors, and each of our 5 counties, our boards of supervisors appoint 3 community members to serve on our board. So that makes it a little different than a traditional we are a not-for-profit organization, but as opposed to a normal not-for-profit where board members are voluntary board members, our board members are actually appointed by local government. And for Culpeper, our board members, Chief Jenkins sits on our board, Richard Brooking, and Dr. Chuck Stein are the 3 appointees from Culpeper that serve on our board. And I think what's really important to understand about that system is because our board members are appointed by local government, we have a really strong connection to ensure that we are responsive to community need, what is happening in our community. So as the chief mentioned, with the pandemic loosening, we see a surge in overdoses and those types of things. He's in my boardroom and he's at my meeting saying, what are you doing about this, Jim? Which is constantly causing us to evolve and adapt as an organization. And I like Officer Jenkins is laughing about Chris showing up in my office yelling, so I think that's good. I won't say I got to talk to a couple of the deputies setting up today, so we can talk later. So as we talk about responding to community need, I think one of the things that's really important to look at right now is the call in our community for the integration and the support of behavioral health with behavioral health to assist law enforcement for individuals in our community who are in crisis. And to do that, I think you really have to a little bit, and I apologize for the graphic I'm going to show in a second, to look at what we call the sequential intercept model, because I think it graphically shows where we come in as an organization. Okay? And so really what you see here and where we as an organization try to come into this game is on the far left. You see what's called Intercept 0, and I apologize if it's small and hard to read, but we'll make sure we have these available to anybody who wants any of these slides at a later time. But what you see at Intercept 0 is community services. And you see things like crisis line and the crisis care continuum. And those are intentionally placed before 911. And the whole idea of the intercept model is that before a member of our community has a behavioral health crisis, we are involved and able to get to that person basically to short circuit this process. Because what we don't want to have happen is for people to go into crisis, call 911, and then you see a very different pathway for individuals in our community. And, I think extremely highly of the Culpeper Police Department. I deal with 9 different law enforcement jurisdictions. And, I am always impressed with the training of the Culpeper Police Department, the commitment to what we call crisis intervention training to de-escalate situations, and the amount of effort that our police department puts into those things. But law enforcement officers are there to enforce the law, right? And so when they get involved, we see a very different pathway. And our goal is to enable behavioral health people to get involved in this pathway prior to a crisis or law enforcement engagement. Okay? So along those lines, and I know Officer Ashley introduced John Bankus to our group, we have begun a program where we actually have an embedded behavioral health professional who is riding along with law enforcement and responding to behavioral health calls that are occurring in our community. And, this is actually a program I know Culpeper has tried for a couple years to get into place in our community. And about a year ago, there was a situation, and another law enforcement jurisdiction that I think does an incredibly good job is the Fauquier County Sheriff's Office. And the Fauquier County Sheriff called me because they got one of these calls. It was a wellness call, and they frequently law enforcement officers are called to do what we call a welfare check. And he called me because they had responded to one of these calls, gone out to see a person who had been threatening to harm themselves. And when their cruiser showed up, the gentleman saw the cruiser, ran into the house, and unfortunately committed suicide. And the law enforcement officers at that time, really went to the sheriff and Fauquier and said, if someone else had responded, we can't guarantee there'd be a different outcome, but we are very convinced that the sight of law enforcement in a cruiser caused this person to make a very bad decision at that point in time. So he came to me. I talked to him a little bit about all the work, in Major Settle. I know he's out with his kid or something right now, but, I know Major Settle and Chris and the chief and I have had these discussions a lot about how do we get these programs going. And luckily, I think all of us got together and started having some conversations we're able to go to the PATH Foundation, the Culpeper Wellness Foundation, and the Northern Piedmont Community Foundation, and we're able, and I'll be honest, this is the great thing of this Culpeper area. It took us about a week to say, this is a really good idea. I know Culpeper Police Department has tried and not been successful in getting these programs funded. I will provide a staff person, but we really need to have more there. Will you each provide money? It took about a week, and we had about $100,000 given to us to initiate a pilot program between the Fauquier Sheriff's Office and the Culpeper Police Department, where we have someone riding along and responding. And again, the goal of all of these programs is to divert individuals from jails, from state hospitals, and we'll talk about the resources by not diverting that really is pulled from these departments. And so I'm going to, excuse me, share just a really quick story. And again, I know it's way too small to read. It's more for my prompting than anything up there at this point. But I'm going to share one story on how this program works and the outcomes we can achieve by having these types of programs in our community. And this was actually sent to me. These are the direct words. We've had the names and those types of things removed from this. But this was the report in the Culpeper Police Department. Today there was a mental health call at address. The individual made a statement to dispatch stating he is seeing things, is off his rocker, has knives, does not want law enforcement to come, will do what he needs to do if law enforcement arrives. The officer contacted the individual who was in his trailer with the door partially opened. The individual was asked to come to the door and speak with the officer, and he declined and stated, "You come inside." After several minutes of speaking, he was persuaded to come to the door. He stated his head was ready to explode and he needed to speak to someone. He spoke of Vietnam days and the shooting of women and children. If he had an M16 today, he could mow down a lot of people. The suggestion was made to go to Culpeper Hospital to speak with mental health. He stated he hates Culpeper Hospital and will not go there. You will not take me easily if I have to go. Our co-responder, John, was riding along with an officer and showed up on the scene. He offered his assistance in speaking with the person if law enforcement agreed. Bankus spoke with the person who was a little standoffish at first. Bankus developed an understanding with the person whose demeanor changed and was happy to go to CIT, that's our Crisis Assessment Center, to be evaluated. He was transported along with Bankus, where he was evaluated and sent home. I believe Mr. Bankus made a big difference today and diverted an event that would have created physical force from an officer-initiated TDO. And again, the last thing we want is our officers and our community members involved in physical force to being harmed. So this person was able to go. A relationship, because of the behavioral health specialist, was able to be initiated. He willingly went. He was evaluated and was actually able to be sent home. And, of course, there's lots of safety plans and those types of things we put in place before he sent home. But I think this really shows, without something like this program, we initiate an ECO, all right? If physical force needs to be involved, that person is put into restraints. He is transported by law enforcement. Again, those are very traumatic events, right? And if the person escalated because of that interaction, then there's a legal process of what we call a temporary detention order, and where we are sitting with people sometimes for hours in ERs, waiting for hospital beds and all those other types of things and transports around the state. So, again, there are story after story of these types of programs and the success they can have in our communities to avert those types of outcomes for people and get people, we always say, the right help at the right time at the right place. Additionally, this year, I think, and kind of very similar to that, is our organization was chosen as the pilots, one of the 5 pilot sites in Virginia for implementation of what's the Marcus Alert legislation. And when you think of Marcus Alert, please don't think of Amber Alerts. There is no alert in Marcus Alert. I don't know why they named it that. It's kind of terrible and misleading to everybody. But at its core, what Marcus Alert seeks to do is help and require every community or every jurisdiction to develop protocols on how law enforcement will respond to behavioral health crises. And again, it's actually named after a gentleman, unfortunately, who lost his life during a behavioral health crisis in the Richmond area a few years ago. Okay. But one of the things that I can't talk more highly enough about that I think is the real magic of and potential of the Marcus Alert is this group. So when we were chosen to implement the Marcus Alert program, one of the things that we had to do was to create a community steering committee, for lack of a better term, or an implementation team. And I know you can't read all these names, but some of the people I will point out to you on there is we have Clarissa Berry. She's the Commonwealth Attorney from Madison County. You see Major Crisetto, who you all know is on our team. You see the Executive Director of the Mental Health Association for our area. You see a community advocate, Hortense Hinton-Jackson, who many people know in this community, sits on this group. You have clinicians in private practice. You have 2 members of the Culpeper Sheriff's Office. You have the NAACP. You have a magistrate. You have Germanna College. As far as I know, this is the first time in our area that we have really had a 5-county group sit together to talk and work out how, as a region, are we going to handle the behavioral health crises that our community members have. And I think it's so important because if you live in Madison, that doesn't mean you're not coming to Culpeper or back and forth and all those types of things. And this is a huge need for our community. And this group is extremely dedicated. We meet every other week. And I think it's been great conversation on how we can have a regional response in our community that is effective in helping people in a behavioral health crisis. So a couple other, I think, real important things with this are, one of the things that has been done is the development of a voluntary database where any of our community members can now go in and enter information voluntarily that can be shared with first responders if first responders are responding to them at their home or those types of things. And, kind of the examples that I often use on why this is so important. I have a son, he's 28 years old, he has a mild autism diagnosis. And we've had this conversation 100 times. If he gets pulled over by a police officer, how do you respond, right? And he's been pulled over by the Culpeper Police Department, and they were great, I got to say, but, that's a whole different story. But if you know somebody with autism, you might get a very different response. You might not get eye contact, right? You might not get a question answered necessarily the way it was asked. Loud noises. My son hates loud noises, right? So loud noises, bright lights, all those types of things can have a different effect on him. If you are a law enforcement officer and you are approaching somebody, and if you have that information, law enforcement tells me over and over, knowledge is power, right? And that's the critical thing. You might respond very differently and understand, he's not avoiding my question. He's not looking away. He's not, doing whatever he might be doing that you wouldn't expect from him. And you would know, I would approach him very differently. One of the places that we looked at when we were developing this database was Newcastle, Delaware. They just did this themselves a couple years ago, and we started having conversations with them. And they started having little notes in their database. And the one that really struck me was they had a gentleman in their community who had a lot of behavioral health issues and was well known to the local police department. And one of the things he did is he had a backpack. Now, when he was being approached by law enforcement, their, protocols, let me see your hands. It's a safety issue, right? And so they would ask him for his backpack. He had a lot of trauma. He had probably maybe a little unreasonable connection to his backpack, but he was never going to give up his backpack. And they had multiple incidents where their officers would approach him, want his backpack, he wouldn't give it, and officers were injured trying to get this backpack from him because they needed to ensure that the situation was safe. They put just a little note into their database that said, when you approach him, there is nothing dangerous in his backpack. Talk to him for 5 minutes, create a relationship, and he will voluntarily give it to you after a couple minutes. And he said, since that point in time, when our officers go out, dispatch has this little note. Backpack is fine. Give him a couple minutes. This is his name. Talk to him this way. He will give you the backpack. They've saved injuries, and it's injuries on law enforcement, and are able to much more effectively interact and have those types of things. And those are types of things that we are looking to do with our database. It's early development. It was a very short turnaround by our General Assembly and having these system in place. So there'll be a lot of kind of media push of it pretty soon. We have it. It's up. It's operational. We're still working out a lot of the bugs. Went one too fast on me, Dan. Okay. Additionally, with the Marcus Alert legislation, because we're one of the early implementers, we received extra funding that has allowed us to do some other community enhancements. And additionally, the money goes hand in hand and kind of runs parallel to some of the other programs that we're going to be running out. Mobile crisis programs. Currently, we have a children mobile crisis program. Again, the beauty of a mobile crisis program is if someone is in need, you can send out a team of behavioral health professionals and avoid having to send law enforcement. Again, it's a resource issue, and it's getting the right people at the right time. We are also in the process of implementing a regional crisis call center, and this will be up and running probably in November. And what this will do for us is when a call comes to 911, dispatchers, if the call is a behavioral health call in nature, that call in real time can be transferred to the regional crisis call center, at which point in time that call will be screened by a trained behavioral health professional. And there's really 4 categories that person in that call would then be put into. And the first one is level 0. And if it's a level 0 call, what that means is there's really not an imminent risk, okay? But someone needs help. And so what that call center would do then is transfer that call to maybe a peer warm line, to some sort of other support line so that family or that individual can receive help and care. Again, diverting that call all from law enforcement. If it's a level 1 call, that call center would have the listing of who all the mobile crisis teams are and can send out a mobile crisis team. If it's a level 2 call, then you're probably looking at a co-responder level call with a behavioral health specialist and law enforcement. And if it's a level 4 call, that means that there's an imminent harm or risk issue, and that would just be sent to law enforcement. We know nationally, by setting up these types of programs, we can divert 60 to 70% of all behavioral health crisis calls that law enforcement is responding to. Okay. Again, the real key too is early getting calls, and if people in our community, if you know that there is another option out there, you're much more willing and likely to reach out and access services. Additionally, we are using some of the money to help support the development of what we are referring to as the C Recovery Center. And C stands for Support, Encourage, and Empower. And really what is as critical with the C Recovery Center is the C Recovery Center will be an immediate access point for members of our 5-county community that will allow community members to connect with a peer recovery specialist or a crisis counselor 24 hours, 7 days a week. Okay. Currently, in our community, because neither of our 2 community hospitals have acute behavioral health beds, there are no what we would call like crisis stabilization units in our area. So the only options we have if a member of our community is in crisis is a legal process. It's the ECO TDO process. That's emergency custody order, temporary detention order process. And with that process, you really have 2 options. A person is brought in by law enforcement, they're evaluated, they either meet criteria to be hospitalized involuntarily, or they're sent home. And so much of what we do, there's a huge gap there between hospitalization and home, but I need help. The C Recovery Center seeks to be that first step in our community to fill that void. So if law enforcement calls us and they're interacting with somebody and they see somebody who doesn't need to be hospitalized, but they need to be out of the environment they're in, they need to sober up, they need just a change of pace, they need to take a shower, they need whatever they might need, they would call our counselors and we would be able to take that person in 24/7 And when they get there, we would have peer counselors, which will always be there, or licensed clinicians through our crisis program. And we can do an on-site assessment of that person and hopefully start that person into some sort of treatment and program. Again, go ahead. Okay. Again, lots of challenges that are being faced right now. Again, the pandemic has really we've seen a real increase in substance use services and mental health symptoms during the pandemic. And I think this is real important information for people to know. Prior to the pandemic, and it's a little worse now, 19% of all adults will experience a mental illness. Okay? And that number has increased by 1.5 million people nationally over the last year. Okay. Suicidal ideation has increased nationally by 0.15%. It doesn't sound like a lot, 0.15%. 0.15% of the United States is 460,000 people. Right? Additionally, what makes it particularly challenging in our area is that we live in an area with a real shortage of providers. And again, a map that means nothing to anybody but me, but we live in what's called a health professional shortage area, HPSA. They scale you on a 0 to 25 scale. For mental health services, 25 is terrible, okay? For our area, for mental health providers, our score is 15. That's a bad score. We are significantly lacking in mental health professionals for our area. We also are currently really struggling with a bed crisis. So about a week and a half or so ago, the commissioner of the Department of Behavioral Health sent a letter closing 5 state hospitals for new admissions and drastically reducing the capacity at the other state hospitals. This has put a tremendous burden on law enforcement because the process is if a person comes to us and is evaluated through our crisis team as needing hospitalization, we have to hold that person until a bed becomes available. I got a call this morning, just as an example of the burden that this places on law enforcement. We have a gentleman in the Fauquier Hospital right now who has been in police custody for 6 days. Okay? It's 24 hours a day for 6 consecutive days waiting for a placement. And that means those are officers who are not doing their job as law enforcement officers. The struggle that we have because of this is in Virginia. Now, Virginia is, I believe, in the bottom third in per capita spending on behavioral health services nationally. I think we're 27 or 28, okay? Which would be okay, except for how we spend our dollars on behavioral health services in Virginia. We spend 75% of our behavioral health spending on state hospitals and 25% on community services. And when we do that, what it really creates is because there's such a lack of community services, you have everybody defaulting to law enforcement, which then defaults people into the state hospital system. So you create this negative cycle loop. We are third worst nationally in that ratio. There's Montana, North Dakota, and Virginia. Okay? That's not probably a place that, I would want Virginia to be. I think we're a better state than that. And so we really need to flip that. In states that have good behavioral health outcomes, you see the exact opposite. You see strong community services funded at about a 75% ratio, and then you have a small funding for the state hospital systems. And again, by doing that, you don't need the state hospital beds, and that's proven over and over nationally. But because we don't, all you have is this default to law enforcement as the crisis services. Additionally, we really struggle with stigma. Stigma is the greatest barrier for people getting help. 40% of people who have anxiety or depression will not seek help because of the stigma of a mental illness. And again, I throw that one up there too, because 20% of us will have a mental illness. So, getting help and accessing services. A couple things to remember. We are the publicly funded behavioral health. we are still a voluntary provider organization. And this always becomes a real challenge. Why don't you serve this person? Why don't you serve that person? We can't force people. There's a few dramatic exceptions, but for the most part, anybody who comes to us must willingly come to us to be served. Okay? We are publicly funded, and so if people do come to us, a lot of times when we assess them, one of the things we're going to assess them for is, are there other options that are not relying on public funding for that person? Do they have insurances? Are there other places for them to get care and support? And so a lot of times we will refer people out. Additionally, because of the services that we provide, we are a very regulated industry with a lot of licensing requirements. So it becomes very challenging sometimes when people will say to us, we get this one a lot, we run the Boxwood Recovery Center. Boxwood is a residential treatment program here in Culpeper. It's a 28-day residential treatment program. We have people come to us all the time saying, my son came to me this morning and said he's ready to clean up. Can I bring him to Boxwood? And we would love to, but we can't. Our licensing and our funders don't allow us to do it that way. There is a process that people have to go through. And it's very frustrating. On the other hand, we do know that when you circumvent that system, people come in and they go out really fast. And the outcomes of those people staying in treatment can be very challenging. Okay? If you need help, we have a crisis line. Again, I always tell people, so if you're out and about, what should you do? How do you get services? If it's a real safety issue, call 911. We are never a substitute for 911. It's not what we do. But if you are in crisis or you see someone in a behavioral health crisis, call us 825-5656. I've got lots of brochures and tchotchke on your tables to take home with all these phone numbers and everything in it for you, and pens and refrigerator magnets and all that type of stuff, so hopefully you'll keep those. But if you call 825-5656, you will be put in touch with a licensed clinical behavioral health specialist. They will go through. They can do phone assessments. They can do triage. I think, in particular, people sometimes don't call them because it's not a crisis, but I'll tell you, one of the best things that they can do is problem solve over the phone. My son has bipolar disorder. He hasn't taken his medications for a few days. I don't want to call law enforcement. What do I do? They can give you those triage points. They can tell you what to do, where to go, how to get help and support. Otherwise, I always tell people to, for any type of services, call our main number, 825-3100, and you will be triaged through that phone call on where to go and what to do. We have visit our webpage, RRCSB. There's instructions on there as well. We have a program called Rapid Access, which is our entry point into services. It can be, I apologize, it is very frustrating at different points in times. The state allows us certain hours that we have, for lack of a better term, free clinicians, where people can go. It used to be pre-COVID, you just show up, right, during these hours, and you could walk in and be evaluated by a licensed clinician. Because we couldn't have people congregating, we have gone to a night before call-in system where they will tell you to come in at a certain time the next day. The Department of Behavioral Health limits the hours that we can do that. And I understand why, but it is very frustrating. And the backside of that, I always try to explain to people as well, is we could expand the rapid access hours, but to do that, I'm taking a licensed clinical person out of therapies and groups and counseling and all those types of things. So when an evaluation was done of our community need, this is what the Department of Behavioral Health said: you need 15 hours a week or 20 hours a week, and they're on our webpage, the hours of free clinician time to handle the volume of people that will come in and do that. So that is always the best way. And I do apologize. I know sometimes we're trying really hard to get that better, and I always tell people, if you have a problem, give me a call. We'll make it right for you. But call that number, get an appointment for the next day. There are certain things that, because I said we're licensed programs, you got to bring. identifications and those types of things. But we try to make it as easy as possible, and we're working hard every day to make it easier for people. Additionally, because of who we are, nobody has ever turned away because of the severity of their need. No one has ever turned away based on their ability to pay. So if you come to us and you have a need, we will get you serviced. So, you have the rapid access area, you have the crisis phone numbers, and in about a month and a half, we will have the C Center. And any one of those becomes kind of the access points, or, if not an access point for you, a point where you can call and talk to someone, at least to get information on what to do next. So how can you help? Things that I think are really important. Appreciate a mental health disability and a substance use disorder is an illness. They're hard to see. It doesn't appear like a broken bone, but these are illnesses. It's not a character flaw. It's not about poverty, and it's not a race issue. Okay? If you think you or someone you know, or you come upon someone and you're kind of working the neighborhood watch, call a professional. Give us a call. We are here to help and give you guidance. Again, encourage people to get help. Again, as we saw earlier, 40% of the people will not get help because of the stigma. Again, we have got to find a way to break the stigma that mental health is a character flaw. It is not. Okay? Take a training. We are constantly running trainings, free trainings for members of our community. Mental health first aid is a great training. How to recognize, what to do if you think, how to approach someone, if you see someone who you believe is having a mental health issue, on what to do and what not to do. I always tell people to take Narcan training. Narcan, if you don't know, is an opioid antagonist. So if you see someone who is overdosing, you can use Narcan and save that person's life. A lot of people, I think, mistakenly think, well, I'm not around drug addicts, I don't need Narcan. Narcan is prescribed for every person in Virginia. You already have a prescription for it. There's a blanket prescription for everybody in Virginia can get Narcan. You can go to any pharmacy and get it. If you go to your pharmacy, they'll charge you for it, and I don't know what the charge is right now. If you come to us, we will give it to you for free. Okay? But I tell people a lot, you have to think about this stuff a little differently. If you are around older adults, you should have Narcan in your home. Last year, my mom, she fell, she broke her pelvis. She came home with a ton of opiates. If you take an opiate, you can get addicted. If you're older, you can forget what you've taken, and you can easily overdose. You need to have this stuff in the house. So, again, it's free. We do trainings all the time. Check out our webpage. You can save someone's life. Okay? And again, I always encourage people as well, check our website. There's always information coming out on our website. Follow us on Facebook, different trainings, different opportunities. When we're opening a new program for allowing you to get access to services like the C Center, it's one of the best ways we can get that information out on who to call, where to get services, how to connect to us. So if you are frustrated about being able to get services, you can have an ability to connect to us directly. And again, I put lots of stuff on your tables, refrigerator magnets, little sheets with lots of phone numbers. Share that information, right? If you have a business and want that information, those types of things, we got to get this information out. We got to let our community members know we are here to help. This is how you get a hold of us, and this is how we can get people saved. Again, it's about helping people. I think it's also about getting people the right help at the right time, but it's also really good public policy. Law enforcement dealing with behavioral health issues is costly and not effective. We are much better from a public policy perspective as well. So if there's questions, I will answer any questions that anybody has.
This is Chris. This is Major Cell in the back. We do have some questions from our audience, not with us tonight. And I'll start off. What strategies are you providing for the provider shortages with all the new programs you're about to implement?
Okay. There's a couple things. One is we are really relooking at some of our recruitment strategies, some sign-on bonuses. Where we struggle tremendously in Culpeper is our ability to keep providers here. It is so easy to drive north from here. And so we have implemented some new pay structures, especially in the licensed professionals, where we've been able now to make our salaries as competitive as Northern Virginia or Fredericksburg or some of those other CSBs. So that has helped a little bit, and we've actually seen some very positive benefit from that in the last couple months. We are also this year going to be starting a scholarship program. And we have a terrible name for it, so no one can write the name down for it, Allison. Because we're still trying to figure out the name. But basically, a Grow a Clinician scholarship program that we will be rolling out for our high schools. So our high school students who are looking to work in this type of field, and our goal is to offer $5,000 a year for freshmen for their first 4 years. And if they go to graduate school and continue on, we would give a scholarship of $10,000 a year. And again, our goal is to be able to identify people who want to work in the behavioral health field, get them experience with us, and help them graduate as well. And we're still working out some of the details, but we have the money budgeted, and I really appreciate the work of our board in supporting that initiative in the coming years. Other questions?
Not seeing audience questions. I have another question that came in. Our Boxwood Treatment Facility, is that for Culpeper residents, or is that a regional or a state rehabilitation center?
Okay. Boxwood Recovery is actually open. It's technically a regional program. So Virginia is divided into 5 health regions. We are Health Region 1, which includes our area. It goes from like Winchester to Fredericksburg to Stanton down to Lynchburg. So it's a very large geographic area. There are 9 community service boards that make up the Health Planning Region 1. Boxwood is technically a regional program that takes admissions from all of those areas. However, we will also take people from other parts of the state occasionally. So if there's someone in another area and we have an opening and a vacancy, occasionally we will take people from other parts of the state as well.
Okay, not seeing. I got more questions back here. Knowing that you don't turn anybody away, do you receive the same services if you don't have insurance or the ability to pay, opposed to having insurance or the ability to pay?
Yes. We do not affect service delivery based on ability to pay. We are required, if you are uninsured, to look at financial ability. So we have a sliding scale, but it's almost nothing.
Go ahead.
More of a comment. I recently had a man that I've been mentoring decide to go into rehab, and we went through the intake process for Boxwood, and it was very thorough, and they left no stone unturned in their ability to get back to you if you drop the call or anything like that. So it went really well, and just wanted to thank you for that service.
Thank you. It's nice to hear. I think, Boxwood is probably our most visible program because it's in Culpeper here. We have, obviously our 5 counties, we have a high drug overdose rate compared to the rest of the state in our region. And so Boxwood, I think, gets a lot of local publicity. It can be challenging. Boxwood is, at this point in time, has the capability of having 24 individuals there. We have a little reduced census just because of COVID and being able to quarantine new people into the facility. But I appreciate that. We try our best. And I think it can be frustrating sometimes, but if someone comes to us, especially people who have insurance, there are other really good substance use treatment options out there. So, a lot of times at Boxwood, after that assessment process, we are helping people go to other facilities. And again, that keeps the local capacity, the publicly funded capacity for those individuals who might not be able to afford or attend other types of facilities to get the care and support they need.
All right, I got another question. How do we flip the spending in the state level from hospitalization money going there to crisis services?
Okay. It's really, really hard because what you have, the way Virginia, I said, is funded, if it's 75 state and 25% funding to community-based and mostly crisis and preventive type of services, the challenge is you almost have to run two programs at once. You have to spend up the community program and get it in place to the point where you're now able to reduce the funding on the state side. And so getting over that hump is really hard. We have a real unique opportunity right now. There is a huge influx of ARPA, which is the Federal American Recovery Plan Act, I guess is the perfect acronym, funding coming into Virginia. This is a once-in-a-lifetime opportunity to take those funds, and the governor has said initially, I believe it's $80 million will go to behavioral health services. We really need to talk to our representatives and say, don't use that money, because I know the Department of Behavioral Health, it's not public, but I've heard that they're wanting to use that money to expand the state hospital system. You are just increasing a bad model. Use that money, bite the bullet today, develop what is needed locally. The only way you're going to get out of that cycle, and this is a once-in-a-lifetime chance, so I would say, talk to your delegates, talk to your representatives, look at this money from a perspective, let's use this money to create the infrastructure that is necessary. We need crisis stabilization units, we need crisis care centers, we need programs like recovery, so that we are not sending people out of our region and into state hospital system. And let's develop the community system, and this is our one-time chance.
All right, one more question from our audience. This is a two-part question, so I'll put you on your toes on this one.
Okay.
How does the hospitals not taking any more, or closing beds or not taking any more patients affect the Culpeper Police Department? And if the Culpeper Police Department releases somebody from confinement, what does that client follow-up look like?
I think the challenge for the Culpeper PD is that the law says you have to get a bed, but you have to go through a medical clearance and acceptance at the state hospital. So there is a legal justification to keep someone in custody. So I don't know, and I apologize, if we've had any long-term custodies from the Culpeper Police Department. As I said earlier, I know there's a current situation in Fauquier that's going on 5 or 6 days at this point in time. So again, it's taking officers either off the streets or huge overtime costs, and it's really frustrating from a law enforcement perspective. The option of releasing people it's such a significant challenge, because if that person goes out and harms themselves, we can't allow that to happen. And I don't think our law enforcement jurisdictions are willing. They're going to bite the bullet to keep people safe. While they're in custody, we will continue to evaluate that person. And one of the things that, the ironic part of all this is that for a high majority of the people who are going through it, we call it the ECO TDO process, they don't need to be hospitalized for 3 months. They need 3 or 4 days of stabilization. So as we're going through this extended custody process, we will continue to evaluate that person over and over. And over time, they get in a hospital, they're at a hospital ER, they might be getting meds that they haven't gotten, they're out of the environment they were in, and 2 or 3 days later, we might evaluate them and say, this person is no longer meeting criteria, and gets released with, and with some follow-up services and those types of things. So I don't know if that really answers the question, but the real challenge, of course, is you have liability issues. If you know someone has been released who, in the opinion and the evaluation of a licensed professional, is a threat to themselves or others. I will say I think there is a very great potential, because there are other law enforcement jurisdictions who are taking a little different approach and have actually released people, as opposed to staying with them through a process where they're eventually either released because they've been evaluated as safe or a hospital bed has become available. There's going to be a tragedy. And when it happens, people are going to be, pointing fingers and looking around and how could this have happened? And then hope, we just hope that never occurs. But if we don't get in front of this, something will happen.
The microphone is coming to you, Chief.
Jim, I don't believe I've missed you. To speak about the homelessness issue in Culpeper, that is a ever-growing issue in affordable housing for folks, because what we see obviously are folks living on park benches in tent cities, under bridges. Most of these folks suffer from mental health issues or substance abuse issues, or a combination of both. Mm-hmm. So they can't hold a job down, they can't find housing, and they have all these other issues. We are obviously encouraged with having an embedded clinical worker to be able to take a caseload and to be able to navigate that person through the many services. And I know Pastor Carlton is here this evening. The Ministerial Association and the ministers and churches in our community does a tremendous job in meeting some of the expenses and help that government doesn't cover. Mm-hmm. But maybe to touch a little bit about the role of the Community Service Board and the homeless issue, as that seems to be another question we get an awful lot about.
Sure. And again, I didn't even, there are so many other tentacles of this organization, that we didn't even talk about. But one of the things that we are also is we are a very large housing provider, particularly as it relates to low income, housing voucher programs and those types of things. We have some housing that we actually do, particularly we have a fairly large senior living, low cost senior housing development. But what we also do is a lot of housing voucher programs, in particular as relate to homelessness or people who have been chronically homeless, who also have substance abuse issues or mental health disabilities. We recently just had a big expansion of a program called Permanent Supported Housing, which is a program where we are able to support the costs of housing and through a voucher program, but also have a lot of wraparound intensive case management services to get people into care and programs. The challenge that we have locally is there are no housing that's affordable, and it's a significant issue. We are continually looking at, partnering with other community groups, CHAZ, Culpeper Housing Association, some of those types of groups, looking at are there affordable housing units that can be developed, because there are frankly just not places for people to go. We have overrun every affordable unit, and I understand the political pressures of affordable housing units and all those types of things, but there are two best pathways to get people healthy are housing. We live in what's called a housing first. You need a stable housing, right? And work. If we get those people housing and employment, their mental health, their substance abuse recovery is infinitely more likely to be successful. And so, we have kind of this perpetuating problem where people, because we don't have affordable housing options in our community, they are living on the streets. It just perpetuates the bad choices. It's around, the other negative items that, they participate in our community. So I don't know if that quite answered your question, Chief, but, if anybody in this room is interested in talking about affordable housing options, we've got a couple of meetings. We've talked about it today with someone from Virginia Housing Authority. but it's a huge issue, and I think getting people housing, we will support them. We have lots of ways to support people financially, and from a service support side, I think it would really help our community. Just turn over here.
Microphone's coming to you.
Mr. LaGraffe, so how does, I'm thinking of the veteran community, recently come into contact with a few veterans in their early 30s, and whether it's a TBI or PTSD, there's this stigma where they don't want to step forward and ask for help. Mm-hmm. And I'd love to be able to steer them someplace where they can get that help. Does RCS interact with the Veterans Affairs Office, or is there another path?
We do have a relationship with Veterans Association. The other thing that I would suggest, and this is one of those give me a call type things, and we'll talk about it. We mentioned the C Recovery Center. We will actually have at the C Recovery a service veteran and military family peer specialist who will be working full-time out of that location. The name C Recovery is stolen with permission from a veteran from Orange County. He was a gentleman. He had a lot of traumatic stress, ended up in prison, and a lot of other bad situations, and ended up in the Veterans Administration. While he was there, started participating in peer services in the Veterans Administration and created what is called the Veteran X program. The Veteran X program is the national standard at Veterans Administrations, and the Support, Encourage, Empower is actually his moniker. He's an Orange County resident who's retiring in a couple months and returning back to Orange County. And so he has given us permission to use the Veteran X model at the C Recovery Center. I will also say the person who oversees our peer services is a veteran and is trained in veteran specific stuff. So if there are veterans in our community, and I didn't want to use it because I couldn't find it and I would mess up all the dates. But the scale of suffering of our veterans. I read something like in the last 10 years, more veterans have died by suicide than died during the Vietnam War. That's a horrific figure. So, we will have, again, specialists there, but we have lots of other ways for veterans. And again, the stigma for veterans is really, really hard. They don't want to get help. And so to be able to, for a lot of services now, one of the things that we are really seeing is peers, people who have lived experience, whether it's a veteran, whether it's someone with a substance use disorder, are really incredibly effective in being able to talk to people, to get people to accept services and break that stigma chain. And it's an area in the last year that we have just exploded organizationally to really increase our peer supports because, when John goes out on a call and meets someone and, he can then go back and say, I have a guy, he's been in your shoes. Is it okay if I give him your name if he stops by and sees you? And you're much more likely to talk to that person initially than you are from, a psychologist knocking on your door.
I'm going to get the last question here. Take 30 seconds. Talk about drug court, the involvement with the Community Service Board, and sort of an update where that's at and where it's headed to. I think that's pretty good information.
Sure. So Culpeper right now is at a place where we have an approved docket for our drug court. We have basically our drug court is ready to go. We are just waiting for, we have applied for a federal startup grant that we should hear. And it's a grant process, but there's a really, if you do the steps, you get the grant for drug courts. We expect to receive notice, if I'm not mistaken, and Chris might know better, I think it's going to be September is when we're expected to hear on the drug court. It's our hope that drug court will be up and running October, November at the latest in our area. Again, drug courts are incredibly effective. And, addiction is really tough. And understanding addiction and being, I don't want to say accepting, but understanding that people will relapse, people will use, But people who enter drug courts and complete a drug court process, first off, we're not paying for them to be in jail. Okay, they're out. It's highly structured. I think some people think drug courts are a free pass. It's the exact opposite. Drug court is much harder than being in jail. You are constantly being tested and monitored with parole and probation and showing up and structured. But you have to learn to work. You have to develop skills. You have to be in education. And again, it's just one of those areas that we can start breaking that chain of, going to prison, being in the prison system, coming out, having no skills, having no car, having no ability to support yourself, relapsing and going back. We will be the treatment provider for drug court. So when people are assigned to us, we will be able to provide their treatment going forward. Sure. Appreciate it. Thank you very much for having me tonight.
Thank you again to Jim LaGraffe for coming up and speaking. You gave a great presentation. On the program, we have comments from the chief. Did you want to say a few words, or are you good? Mm-hmm. Yes. Yes. Yes, thank you again. Again, I want to thank everyone for coming. I just want to go over two more things. I want to say thank you to our support staff at the PD, Ms. Bennett, Ms. Nicholson, Ms. Brown, Ms. Lloyd Soley, for doing their work with catering, making sure everybody had plenty of food to eat. So I think most of them left, but Ms. Bennett is still in back, so thank you. Make sure you tell all the ladies thank you. And one other thing before we get to the best part, door prizes, just want to remind everyone that less than 2 weeks away is National Night Out, which is Tuesday, August 3rd. National Night Out is designed to enhance the relationship between neighbors and law enforcement while bringing back a true sense of community. I think tonight it's just a perfect example of holding this meeting and bringing us back with the community. It's bringing police and neighbors together under positive circumstances. And for National Night Out, for the 31 neighborhoods and business watches, doing a various amount of different things. We'll have police, fire department, and EMS units for display. I know a lot of groups are doing pizza parties, ice cream socials, barbecues, a lot of events. So make sure you mark your calendars for a National Night Out. And as a reminder, our next meeting will be September 23rd at 6:30. So hope to see everyone there, and make sure you bring a friend.